And the victims of sexual assault now travel a lot further to get crucial DNA evidence collected.
Since September, women have been unable to find the specially trained medical personnel here in the Wiregrass to collect that evidence. And WDHN's Allison Polk is live in the newsroom to break down what this means. Allison?
DNA evidence could be the difference between convicting a rapist and allowing one to go free, but it's going to take some time and travel for victims in our area.
For victims of sexual assault, there are a few places in the state of Alabama that can conduct a rape kit, collecting valuable DNA evidence after the attack, evidence that could convict a rapist. In 2016, Southeast Health saw the problem and staffed a sexual assault nurse examiner or SANE program, making it possible for victims of rape to have evidence collected right here in the Wiregrass.
Having a rape kit done when they are at the point of agreeing to that made them feel as though I did it. I did everything that I needed to do in order to get that perpetrator tried.
Since the SANE program was implemented at Southeast Health, Angela Underwood with the House of Ruth has worked closely with the hospital and law enforcement to be an advocate for rape victims. But in September, this program came to an end. In a statement, Southeast Health said they had to discontinue the service when the hospital was unable to staff it with the specially trained nurses who are needed.
For so many victims, it's hard to go through that process. It's even harder now because we don't have the SANE center at the Southeast.
In order for a nurse to be SANE certified, they have to undergo about 80 hours of training. From there, these nurses are on call 24/7 and must be able to respond when needed. Southeast Health says nationally there is a shortage of registered nurses who are specifically trained to work with victims of sexual assault, and that's true here in the Wiregrass as well.
Some people worry that the extra time and travel could discourage some victims from seeking a rape kit, especially if they're already reluctant to have the procedure. Southeast Health says that in the future, they're interested in collaborating with law enforcement and other healthcare providers to make sure this service is available once again in the Wiregrass.